Doctor, by the way, and along with him is a Democratic congressman from Pennsylvania, Chaka Fattah. Congressman Fattah, let me begin with you. President Obama, Harry Reid, Nancy Pelosi have all said that under the Senate bill, taxpayer dollars will not be used for abortion. You just heard what Henry Waxman said, according to Bart Stupak. Who's telling the truth here?
Well, I think the truth is we're going to hear at least one big lie a day trying to distract people from what actually is in the bill. This bill is going to help 30+ million Americans get insurance. Once it's signed this year,
was
it's going to
Waxman
help
telling
thousands.
the truth? Taxpayer dollars will be used to fund abortions. Was Waxman confessing the truth to Bart
Greg,
Stupak?
it's a distraction. It's a distraction. The Stupak is not for the bill, and a lot of people on this network are not for the bill. Let's deal with the truth, though. The truth is it's going to help a lot of people, millions of Americans, none of which have y'all taken the time to go out and cover the people who can't get insurance. They're going to be able to be covered immediately under this bill.
Will the Senate bill pay for abortions?
The bill says very clearly what the facts are. People can read it for themselves.
And what was Henry Waxman saying?
Well, the federal law is not going to be changed on abortion. And as much as you try to distract people onto that road,
it's not
what we
me.
need to talk about...
It's not me. It's Henry Waxman and Bart Stupak. And Congressman Price, I want you to weigh in.
Well, why don't you tell your viewers what Henry Waxman said?
Have taxpayers pay for abortions, yes or no?
There are plenty of pro-life Democrats who are going to vote for this bill.
Congressman Price.
The Senate bill includes federal funds for abortion, and Bart Stupak, far be it from me to defend him as he's a Democrat on the other side, but he voted for this bill initially when it came through the House because of the 240 to 190 vote that stipulated that current law had to be continued, and that is that no federal funds would be used for abortion. But it's not just abortion. It's abortion, and it's the Cornhusker kickback, it's the Louisiana Purchase, it's the federal Gatorade, it's the increase in taxes, it's the slashes to Medicare. Yeah. The American people have spoken loudly that they don't want this bill.
Who's lying here, then?
That's why they got to go through all these contortions.
Is it Nancy Pelosi, Harry Reid, President Obama? Is it Bart Stupak? I mean, I'm trying to figure this out, and I think our viewers probably are too. Congressman Price?
Well, you're right, and the viewers, the American people, are so frustrated because they get different stories that don't comport with the truth. The truth of the matter is all those things are in this bill, and that's why the American people, 2 and 3 to 1, have said they don't want it. So they've got to come through these incredible contortions to try to pass this bill. The American people have spoken clearly. They want patients and families and doctors to make medical decisions. This bill won't allow that.
We're not going to try to pass it. We're not going to try to pass it. We're going to pass it this week. And we're finally going to join the rest of the industrialized world in making sure that our citizens have access to health care.
Yeah. Congressman Price, Congressman Price, Ray LaHood, a lifelong Republican transportation secretary, says that it is morally reprehensible that 40 million Americans do not have health care. Is he right?
Well, 40 million Americans do have health care. They don't have health care coverage, and that's what we need to get them. But we want them, Republicans want them to get the health coverage that they want for themselves and their family, not that the government wants for them. That's the difference. The question is, who's going to be deciding? Who's going to be making medical decisions? We believe it ought to be patients and families and doctors.
Well, Greg, I think
the Democrats believe that it ought to be the federal government.
Congressman Fattah?
Well, Greg, I think you can see it. To the Republican Party and my colleagues who are Republican, these people who don't have coverage, they're invisible. They don't see them. And that's why they lack any willingness to come to the table and move a health care reform bill. But we're going to get it done. We're going to get it done this week. And we've been working at this as a country for 100+ years. But it's going to be accomplished, and it's going to be accomplished with Democrats standing up to make sure that it happens.
Go ahead, Congressman Price.
H.R. 3400 is a positive solution to get the American people covered, again, with the kind of coverage that they want for themselves and their families, not that the government wants for them.
Again, I come back to Ray LaHood. He's a Republican. He's well respected within the GOP party. And in an op-ed piece, he says not only is it morally reprehensible that 40 million Americans don't have health care coverage, he says that this existing bill, if passed, would reduce the deficit by $1 trillion over the next 2 decades. It would reduce waste and fraud. It is fiscally responsible. Now, you're a doctor, Congressman Price. Is Ray LaHood wrong?
I believe he's wrong because the way that they get to their fiscal responsibility is to increase taxes by $500 billion and to slash Medicare by $500 billion. That's not what you have to do because there are positive solutions out there that will get folks covered, that will solve the insurance challenges and address the lawsuit abuse that this bill doesn't do, and not do it with all the bribes and the kickbacks that they've had in the Senate bill that the House folks are going to have to vote on. There are positive ways to solve this without putting the government in charge.
Congressman Fattah, maybe Ray LaHood's just carrying the water bucket for his boss, the president.
Well, maybe so, but if you take a Fox commentator like Newt Gingrich, my friend who was the former speaker, he says you could cut $700 billion out of Medicare in any given year. There's so much fraud and waste. And now, he's not shelling for his boss at Fox News. He's telling the truth, that we know there's waste in this system. We also know that it is morally wrong for us to have
Congressman Fattah,
so many millions.
Let me slip in one more question to you. Would you agree we've done an abysmal job running Medicare, Medicaid, and Social Security, all of which are heading toward bankruptcy? What makes you think that we can do a better job with basically, health care for all?
Well, you just heard my colleague, Dr. Price, say that Medicare was so sacred, so important, we can't cut a dime from it, that it's helping so many millions of seniors. We're not going to cut Medicare. What we're cutting is a corporate subsidy under Medicare Advantage, and we're not eliminating it. We're just saying they have to produce their services at the same rate that the government does, and we know the private sector is capable of doing that.
Congressman Price, I want you to get in the last word, but address, if you will, how entitlement programs have been abysmally run in the United States. Maybe this one will be different.
No, it can't be. All of the 4 medical programs that the federal government runs, Medicare, Medicaid, the VA Health Service, and the Indian Health Service, all have overrun their costs and they ration care. And if this passes, that's exactly what this will do. The way that they save money is by rationing care to seniors. That's wrong, and the American people won't stand for it.
Well, it does have some Republican ideas in it, Congressman Price. Interstate sales, which would arguably lower, the cost of premium, pooling premiums, among businesses. Aren't those good ideas in this bill?
You're right, Greg. It's got the heading of interstate sales. The problem is all you can buy is the program, the coverage that the government says is going to be available for you, not the one that you want for yourself and for your family. And that's the rub.
Look, Greg,
who's going to be making these decisions? Is it going to be families and patients and doctors, or is it going to be the federal government?
Last word.
We saw the Texas textbook vote. After everybody had their say, there was a vote, right? You're going to see another vote this week, and there's going to be a different result. That is, the people are going to win, and we're going to make sure that there's health care reform in this country right now.
We'll wait and see.
I hope we vote on the bill.
Congressman Fattah, Congressman Price, thank you both for being with us. It's going to be a fascinating week. We'll see it unfold. Thank you.
Thank you.
By the way, health care, a big